What to expect when they're expecting. Pregnant nursing moms is one of the longer foster opportunities offered at the MSPCA, upwards about 3+ months between the duration of mom's pregnancy, the nursing period, and then the eventual adoption of herself as well as her kittens down the road. The gestation period for a pregnant cat is between 58 to 67 days. We are typically not able to give exact numbers of kittens, but our vet team will be able to give a best estimate. But often it is kind of a bit of a waiting game for a mom to pop and have her babies. The due date is about a rough estimate determined via physical exam. Ultrasounds are occasionally done for more precision if there is a determined medical need for it, but it is just not something we are always 100% able to do for every single situation. But your foster coordinator will definitely be able to give you as much of an idea as we possibly can. How to set up space for mom. It's really important to be able to set up a safe, secure space for her and her eventual kittens once she does deliver. So it's definitely important to make sure to block off any major areas mom could hide in: closets, heating, AC vents, under the bed, couch. Ideally, it should be a room that is unoccupied the majority of the time without a lot of furniture, especially pieces of furniture that are large and more clunky and, potentially just risk of her or herself getting stuck within that furniture itself. And then it's also very important to have a room without resident pet access, just for, stress level for mom as well as her babies. And then it's important to prepare a birthing area for her to nest in. This should be a small semi-enclosed space that mom can come and go from. Examples can be the bottom half of a dog crate, a spacious cat carrier, or a box with sides cut out, as kind of demonstrated in the photos there. You are able to kind of DIY and make one yourself, but then occasionally we will get small collapsible playpens donated to our locations that can be, stored for future use. However, it is important that whatever, materials you use during this is something that is able to be properly cleaned between litters. So, cardboard boxes are not the most ideal in those particular things, unless you are planning to make a new one for the next pregnant or nursing mom you do take home to foster. And then within the birthing area itself, you want to be able to provide blankets for comfort and warmth, but not too many where, it's too much material, too much fabric where, kittens are going to get buried underneath. And then it's also important to not use like terry cloth towels or ones that have, some of the finer little pieces attached that can, cause their claws to get stuck and, things to get caught into it. And then the sides of the birthing area itself should be high enough to keep kittens contained inside, so they don't, worm their way outside of it and then get lost within the room. And then do not disturb mom while she investigates the new space, while she, first gets into that room after you take her home from the shelter. It's definitely important to kind of give her that time and space and, relaxation to be able to kind of acclimate into that new space. And if available, the MSPCA at times does have web cameras that are kind of able to be handed out to fosters to be able to monitor mom closely, when you are not in the room when she is accessing that space. And then let me see here. And then don't be surprised if she ends up choosing another random area within the room. Often mom will, pick different locations, before birth, and then even after birth, it is very common for moms to move kittens around that space. Signs of labor. You will start to notice mom's mammary glands will increase in size about a week or so before birth. Around 2 days before birth, mom will start to produce milk. So you might see some discharge coming from each of her nipples. She might become more restless, moving about to other places within the room that she might not have before. They kind of get, they more investigate the space that they're in as well, and kind of, just get a little bit more agitated. And that is all very normal for them. You might notice some less interest in food, as well as she will start to persistently lick at her belly and vaginal area. Labor, 99% of moms don't need assistance with that. So it is, the best practice to not interfere with her as much unless it is necessary. Moms will often have kittens in the middle of the night or without, fosters necessarily knowing that it is happening. So, with those web cameras, if you do have access to one already, or if you do borrow one from one of the shelters, we, sometimes that is kind of an easier way that you are removed from the situation. So you're not causing her any undue stress, but also at the same time, still being able to keep an eye on things. But definitely it is very common, and to not be surprised, as moms will often be sneaky about it. And it is often more of an instinctual thing for them to deliver during quiet times when the foster is sleeping or out of the home. So you might walk into her room at some point and be surprised with babies. And that is all very common. You will notice there's some labored breathing, open mouth panting, yowling, and pacing. You will start to notice vaginal discharge as labor progresses. It is colorless at first, but then it does tend to become more blood tinged as she starts to get contractions and begin the delivery process. Contractions will also begin at this time, and they will start to become closer together. About 30 seconds apart, delivery will begin. And again, this is what things look like if you do happen to be present, in her space or watching her on camera. This is what it typically looks like. But again, definitely, something to not be surprised if you do wake up the next morning and she has had those kittens overnight. That is very common for mamas to do. In the birth itself, usually delivery time is between 2 to 6 hours. Usually it takes about 15 to 20 seconds for the kittens to fully come out. Kittens arrive in an amniotic sac head first, but sometimes they can be in a breech position, which does mean legs first. Breech kittens in itself, just due to the position, can be difficult for moms. She might become more agitated and move about to release that stuck kitten that can kind of get wedged in the birth canal. If she does become weakened or become very distressed, we do ask that folks follow the emergency protocols, which will be provided to you. And again, this is all things that we're to have, to keep an eye on in the event you are present for the birth. But sometimes, again, you might notice these things later on in the delivery, but it is just something we do want folks to keep an eye out for. Post-birth, mom will shred the amniotic sac, allowing the kitten to breathe. Mom will clean the nose and the mouth of the kitten to enable it to breathe. She will bite through the umbilical cord and ingest up to 1 inch, which goes up to the baby. So there's about 1 inch left of that umbilical cord, which will eventually dry up and fall off. Mom will eat the placenta, which gives her extra nutrition. If she doesn't eat it, you can discard it. Mom will vigorously lick the kitten all over, which helps fur to dry and to keep warm. In the rare case, mom will not care for a kitten after birth or kittens after birth. It will require you to, step in and do the following. You can gently remove that amniotic sac, being very careful to not pull on that umbilical cord during that process. You can gently rub the kitten in a soft towel to stimulate breathing. You would tie off the umbilical cord with a bit of dental floss, and you can snip that cord with a pair of scissors that are sterile and clean scissors, definitely important. And then again, leaving up to that 1 inch piece that can be still attached to the kitten. And then once that is all taken care of, you can place the kitten on mom's nipple, and hopefully it will stimulate the kitten to start nursing and suckling on its own. If mom is completely ignoring the kitten, a particular kitten or kittens after your assistance, please reach out to your coordinator to discuss further, as other steps might need to be taken to ensure the well-being of that particular kitten as well as mom. And signs of the ignorance and everything would include walking away from them, refusing to allow them to nurse, and or not providing them with her warmth, or cleaning them and staying right by them right after birth. And so here are some common pregnant mom emergencies. Gestation for more than 66 days, mom suddenly appears to tire before or after the first kitten is born. She will be lethargic and distressed, which can be a sign of uterine inertia, which is just a complication of the uterus itself being able to properly remove the kittens and, go through the natural progression of birth. The kitten is lodged in the canal for more than several minutes after she does begin pushing. For more than 4 hours between kittens, strong contractions for more than an hour, vaginal discharge or odor or bleeding profusely. So it is more of an excess than what we would normally expect. In the event of an emergency, please follow the emergency protocols, which will have been provided to you. All right, post-birth. Is important to count the number of kittens and report colors and numbers to your foster coordinator, which allows us to make the kittens records in our database to be able to monitor them forward and have, complete and, just be able to track their medical moving forward. And it is important also to disturb mom as little as possible over the first few days. It is important to let her bond with her babies during this critical time. Keep the foster room clean, quiet, and dimly lit. You can clean around the area after birth and provide mom with fresh food and water. After a few days, you can pick up the kittens to visually inspect them, looking at their sizes, looking for any obvious concerns physically from an outright perspective. It is definitely important, though, when you are planning to handle the kittens at this early and young of an age, that you want to be able to read mom's body language before handling. Some moms may be protective of their kittens, so best to handle them quickly and only when necessary. Post-birth. So you're going to want to do your best to keep an eye on the kittens to ensure everyone is nursing, especially the runts who are sometimes getting pushed off from the nipples by litter mates. There's different levels of strength within a litter, and some kittens might fall behind on growth and development, while other kittens might progress more quickly. But during this, that can lead to some kittens falling behind and kind of, getting bullied off the milk supply by some of their other litter mates who might just be stronger. Kittens often will compete for the most productive nipples, and those that win the battles will grow the fastest. After 1 week, you can begin to weigh the kittens daily, and it is very important to be keeping monitoring charts for that. You should see a steady increase of around half an ounce gain per day. Weighing kittens is extremely important as it helps us to actively identify concerns, and our vet team is able to step in if there is a concern brewing, such as if they stop gaining weight, they plateau for a few days, or they begin to lose weight. So it is important to be really consistent about weight charting, and ideally this is to be happening at the same time every single day, just for consistency. So some post-birth health concerns, non-emergency concerns would be pooping problems, and that is something we'll cover in a future slide. Not suckling despite troubleshooting, which means you are physically picking the kitten up, reading mom's body language at the same time, but also just actively trying to put the kitten back onto her nipples to see if maybe just physically manipulating them, putting them closer will get them to start suckling and latching, but definitely is a concern, though, if the kitten is not suckling despite our, intervention as foster caregivers. Weight loss for more than 2 days. For kittens under 2 weeks, we would ask that fosters report this to us if it loses for more than 1 day, if they are under that 2-week mark, just because things can happen a little bit more quickly of a concern for, during that time frame. Weight plateau for more than 2 days. So if they don't gain for more than those 2 days, definitely let us know. Sneezing, eye, nose discharge, hair loss, scabs, visible parasites in stool, visible parasites on hair coat, or limping or injured. Emergency concerns would be listlessness, non-responsive, can't lift head. So if they are just very lethargic, relatively immobile, continuing rapid weight loss, where it is a very drastic drop from one daily check-in to another, gasping for breath, any breathing concerns definitely is cause of an emergency, seizures, facial swelling, allergic reaction, or toxic ingestion. And then emergencies, emergencies during business hours. If your foster pet is experiencing a medical emergency during those business hours, you are to contact your foster care coordinator. Depending on the severity of the situation and time frame, we may directly direct you to head to the emergency room. Emergencies off business hours. If your pet is experiencing a medical emergency after hours, you are to head directly to one of Angell's emergency rooms. It is recommended to call the ER ahead of time to make them aware you are on your way with an MSPCA foster pet. Once you have arrived, please contact your foster coordinator to make them aware of the visit, but the Angell emergency centers will be able to take it from there, and then your foster coordinator will follow up the next day. Pooping problems. Pooping problems is just something we always encounter as foster caregivers with kittens. It is pretty common for them to have, bouts of diarrhea, but then also have some normal, consistent poop. So it's just something we have to navigate, as diarrhea can be a cause for concern for a kitten pretty quickly and can indicate parasites or potentially something else internally that could be a cause for concern for them. So what is normal poop? So there's that diagram on the right-hand side that kind of just shows, the progression of normal-ish stool to diarrhea. So typically 2 is kind of the most ideal, and that is more ideal for an adult. Kittens, however, their poop tends to kind of be more on a 4 to 5 level. Their poop tends to be a little bit softer than what an adult cat's poop would be. However, it can progress pretty quickly to diarrhea, so it's definitely something we want to stay on top of as much as we can. So baby kitten poop, for the first few weeks, it will appear mustard yellow in color. Mom will stimulate them and, pretty much take it from there and keep them clean. So often you won't see any of their stool until they start to use the litter box. However, you will see mom's stool. So if mom is having diarrhea, that, is something to make your foster coordinator aware of, because sometimes that, any issue with her can directly impact the kittens. So we kind of want to stay, on top of that as much as possible. And every kitten should poop about once a day. Diarrhea and constipation. Diarrhea is prior, looking back at that chart there, it is a 6 to 7. So the ones right on the bottom down there. We would ask that fosters report if it's more than 2 days of diarrhea for mom or babies. If the kitten is less than 2 weeks old and you happen to see that poop, to report if it has been more than 1 day of diarrhea. Constipation is also something we can encounter, especially with young kittens. So it is important to report to us if a kitten hasn't pooped in 2 days or more. Report if excessively crying or straining when they are using the litter box. If they have gotten to that age where they are starting to become litter box trained, you will notice that the kitten appears bloated and then the abdomen appears firm to the touch, which you can kind of assess on your own by gently squeezing between 2 fingers. And, if the kitten is clearly uncomfortable or is flinching or crying when the abdomen is gently squeezed, that can be indicative of constipation concerns. Both diarrhea and constipation can be treated once a cause is found. It might take time to investigate the cause, but we'll definitely do everything within our power through our veterinary team to kind of figure out what's going on. It can be dangerous, very dangerous for young kittens to develop diarrhea and, continue to struggle with diarrhea as well as constipation. So we definitely want our concerns to be brought to our attention as soon as, necessary. That way our veterinarians can begin a treatment plan. Supplemental bottle feeding. Supplemental bottle feeding is used for kittens who are struggling to nurse or are losing weight. Sometimes we do need to step in as foster caregivers for those kittens that are falling behind in growth and weight gain, to better support them if, they're not necessarily getting as much nutrients as they need from their mother. If you have a concern about any of those things and you feel like that kitten is, again, through reflecting through the weight charts, if you're noticing they're losing weight or not gaining, that is something to report to your foster coordinator, and we will discuss a plan with you. We do ask that you do not start supplemental feeding prior to speaking with your foster care coordinator or a mentor. We are in the process of building out a mentorship plan to, better support new foster caregivers that have not done supplemental bottle feeding before, just because it's a skill that does need to be practiced to be able to properly be bottle feeding these, vulnerable young kittens. Kittens occasionally will resume nursing after maybe a little bit of a supportive, session, a couple days. They might need some supplemental bottle feeding for, and then they might be able to, start to go back to mom. And, with some troubleshooting, we can put them back on the nipple with her and see, if they will start to, get on the right track, I guess. But sometimes they also might not, so they might require supplemental feeding until they are weaned. And weaning, this tends to occur around 4 weeks old for kittens. It's not, a definite time frame. Every kitten is an individual, but usually the general time frame for this is around 4 weeks old. Kittens, what's the beauty of having mom involved is that the kittens will tend to follow mom's lead with this. So they'll start to, they're picking up on what she is doing when she is eating her meals, and they will start to investigate on their own and kind of mirroring her behavior. So they might not need, our guidance, and typically will follow mom's behavior fully. But sometimes, we do have to help a little bit to kind of get them encouraged to, start to investigate the food. So it's great with kittens to start offering small amounts of canned food to them. Start with mostly liquid. So it's definitely better to, start with more of a slurry is what we tend to call it. So mixing in wet food and water together to kind of make it a little bit more soupy. It's easier for them to kind of suckle. They'll continue to do that suckling behavior that they have been doing when they are nursing off mom directly, and they're kind of suckling in the wet food and the water. So when it's more soupy, it's easier for them to do that with. But you definitely want to start that way, and then you can gradually make your way as they figure it out over to more chunky and having less water in it, and kind of what more is stereotypical wet food. But starting with liquid is usually going to be more successful, and then kind of gradually working your way over to more chunky. You can begin by feeding them in a bowl. You want to make sure the edges are not sharp, as typically they'll bite at the edges as they are kind of figuring out. They kind of chomp around and they try to suckle off the bowl and, suckle on the sides of the bowl. So it's easier, and safer, of course, for them to not have anything that could potentially hurt them. So you can do a shallow dish. You can use a little bit of a plate sort of container, something, that's easy for them to have their heads be able to get into, but also safe enough that they're not going to, injure themselves or, make too much of a mess as well. Sometimes if you give them a really big bowl, they're going to climb in it and they're just going to make a mess. So sometimes it's a little easier to kind of have a sort of shallow dish situation that, they can get their head into, but can't necessarily walk all the way through it. But they're messy. They're always going to make to a degree of a mess. So it's just kind of to be expected. And again, like I mentioned before, kittens might not necessarily need our guidance. They might be able to shadow mom's behavior entirely when it comes to eating, but some kittens take a little bit longer to figure it out, and we can, certainly assist. So sometimes I've found it helpful in the past to use my finger and, get a few pieces of, a couple drops of the slurry onto it, and you can kind of guide it to the kitten's mouth. But you do want to watch your fingers while they're doing this, because sometimes the kittens will bite down, on the food as they're suckling it, or they'll suckle your finger and they might get you with their teeth a little bit. So you just want to kind of keep an eye on, what they're doing while you're trying to feed it to them. And then you can also, as they are getting really excited about the food and suckling it off your finger a little bit, you can gradually guide your finger down to the bowl with kind of the kitten's mouth, following it along. And then usually with a little bit of that guidance, they're going to kind of start to, they'll have their head in the dish at that point. And usually that works pretty well to, get them starting to suckle the food in the dish. And, they just need a little bit of just some guidance to figure it out. And then making sure the kittens are actually eating, not just suckling on the food. So, it's kind of a bit of a balance during this time period where they're going to be still nursing off mom, but also, starting to figure out food. So they're going to start with more of the suckling and then kind of gradually work their way into actually eating the food. But sometimes that will take a little bit of time for them to figure out. But you just, want to continue again to keep an eye on their weights, because that is going to be your way to ensure that they are getting full meals, both between mom, but then also the food. Some moms can start to kick their babies kind of off and will stop nursing them as much during this time frame. So it's a little bit of a limbo time period. So you just want to keep an eye on these things, to make sure that the kittens are getting full meals between mom if she is continuing to allow them to, and then also the solid food as they continue to wean fully onto normal kitten dry and wet food. And then you can also begin, as they, are starting to figure out the wet food, you can start to offer some dry kitten food, but you do kind of want to keep an eye on them when they are, investigating the dry food, just so, they're not choking on anything. But again, usually they're going to figure out the wet food first, and then they will start to explore the crunchies. Some kittens can take longer than others to get the hang of eating. This can again happen between 4 to 6, sometimes 7 weeks of age. Sometimes they can be a little bit slower to pick it up. But as long as mom is continuing to allow them to nurse while they are getting the hang of solid food, then everything should be good, and it's just going to take a little bit longer. And then again, just the importance of weight monitoring is just something we will continue to discuss throughout fostering, because it is the best way for us to keep tabs on these guys and, be able to involve any veterinary support if any concerns do come up. We're going to notice it first if a kitten is starting to have issues gaining weight. Litter box training. This also will begin at around 4 weeks old. Kittens tend to follow mom's lead with this. You can start to use pelleted litter with them or non-clumping clay litter. So kittens are kind of a little bit of troublemakers when it comes to litter and things like that during this phase. They sometimes will try to eat it, and they, might play in with it with a lot more and think it's more of a toy versus, actually a litter box. So the importance of using pelleted litter or non-clumping litter is just if they do start to try to eat it at all, it, is not going to be harmful for them if they do, do it right away. But if you are noticing a kitten is trying to eat any of the clay litter, it is going to be important just to switch over to a bigger pelleted brand, which they cannot ingest. But it is very important to not be using any clumping clay litter with kittens, regardless of age, just because if they are eating any clay litter, if it is clumping, that is going to clump in their stomach, and that is going to cause some big problems. So it's just really important to be mindful of what litter you are using for mom, and then eventually what litter you will be offering the kittens to use. In terms of a litter box itself, you can use like a cardboard box, which can, be quick and easy cleanup, or a small plastic or shallow, metal litter box that can also be, disinfected and cleaned, as needed. For cardboard boxes, we often find the bottom of a case of wet food to be really useful for this, because those can also be disposed pretty quickly, but obviously you kind of need more of a ongoing supply of those. So it's kind of whatever, makes sense in the space you're going to be using for a foster space. And then, how you plan to be cleaning them. Some kittens, again, they think this is a toy most of the time. So sometimes it takes a little bit of intervention on our part. You can, gently take one of their paws and scratch at the litter if it does seem like they need guidance. Again, they'll play with it probably to start for a while, but then they, the instincts do start to kick in, and they'll, notice mom starting to, be doing her normal business. And then typically they will figure it out. Just again, as always with these, it just kind of takes time, and each individual kitten kind of figures it out, on their own time frame. And then again, like I said, often kittens will play around in the litter, but eventually the instincts kick in. They will focus, and you'll kind of, see the picture on the right where they kind of go into a little bit of a trance, and they just focus on what they're doing. But it does often require trial and error and patience, as they are bound to have accidents during this time. Depending on what the space they're currently, they are housed in. If it's too big of a space, they might kind of, have an accident on the other side of the room. So it is recommended to have multiple litter boxes, especially if it is a larger litter. You're going to want that anyway. But just kind of having litter boxes scattered about the room is going to be better and less likely for them to have accidents, just because if they have to walk very far to get to a litter box, that's not going to work out very well, just because they get distracted, by anything. They're little busy bodies, so they're not, always going to have the best attention span to actively go get to a litter box. And it is important to ensure kittens are kept clean if they are making a mess of themselves. We often are going to need to give butt baths if needed. Again, the beauty of having mom involved is usually she will assist in keeping the kittens clean, but sometimes it does require, if they make a really big mess or if they are struggling with some diarrhea, that's being treated, during that time frame, they might have an accident and they might get it over, all over themselves. So we might need to step in to be able to, provide that butt bath.
Good morning, kitten ladies and gentlemen, and good morning to you, Zuma. I am reporting live from the kitten bathroom where I am about to give the kittens a bunch of butt baths. These guys are just over 3 weeks old, and one of the things that starts happening between 3 and 4 weeks old is they start to discover the litter box. These guys haven't quite mastered the litter box yet, so sometimes in between their feedings, they will accidentally poop on themselves, doing what I call an oopsie poopsie. Who's got poop hanging from their butts? Is it you? Oh yeah, you got poop hanging from your butt. Ew, yeah, you got poops. Balboa looks nice and clean though. Good job, Balboa. Now these guys are orphans, and if they had a mom cat, their mom would be meticulously cleaning them. I do the same thing with baby wipes, but sometimes the oopsie poopsies are a little too strong and they have to get a butt bath. You have to be really careful when you're bathing these little guys because they can't regulate their own body temperature. So you have to do it quickly in a way that's warm and that doesn't stress them out. So this morning, I'm going to show you guys how to do a safe and easy butt bath on a kitten. I want to make sure these guys are going to be warm when they get out of their bath. So the first thing I do is heat up a heat pad and stick it right under a soft baby blanket. That way the baby blanket can get nice and cozy and warm so that when they get out of their bath, they have a warm spot to return to. Come on, Zuma, let's go. Kittens can get cold really easily, so it's important that you get the temperature right. While that's warming up, I'm going to grab some washcloths. All right, my water's nice and warm, so I plug the sink and I get ready for Zuma's bath. I'm just soaking Zuma's little butt in the water. You never want to dunk more of the kitten than needs to be cleaned because this is a really stressful thing for them. So I just dunked their bottom half in there. Since Zuma's pretty crusty, I'm going to let her soak for about 30 seconds. Now there's a couple different products you can use for this. You can use dish soap, which helps break down oils. Or you can use an unscented baby shampoo. I like to use baby shampoo for these little guys. It's pretty gentle. I prefer one that's fragrance-free. I prefer one that's cruelty-free and organic if possible. The one that I'm using with them is just a fragrance-free baby bath that is not tested on animals. Okay. I'm not washing her entire body. I'm just washing the parts that have poop on them. I try to do this as quickly as possible, but also as thorough as possible because I don't want her to have any poop left behind. Now I am going to rinse her butt with fresh water. Of course, I don't want to rinse her butt with the dirty poop water. I just run some water over her tail, always protecting her face, always protecting her eyes and ears and mouth. Just rinsing the butt. Just a little butt bath. And that's it. Then you can dry them off. Kittens don't like being wet, so you want to try to get them dry as fast as possible. The first method for getting her dry is just vigorously rubbing her with a washcloth. Another method you can do is to back comb the kitten using a toothbrush. This just helps aerate the fur and get it dry faster. Okay, you little fluff butt, you're all done. Next in line, Topanga. Plugging the sink, making sure that it's nice fresh water for her. And then dunk. Dunk her in the bath. Yeah, I know, butt baths are not a kitten's favorite. Now that her butt has soaked, I just use a little bit of baby shampoo to suds it up. I know. Am I making you get a butt bath on YouTube? Yeah, I'm sorry. So what I'm doing is just rubbing the butt. You may find that sometimes when you're rubbing their butt, it actually stimulates them to go poop in the bath. And while that's a little gross, no better place to poop than when you're already getting a butt bath, right? It's okay, Topanga. We all poop in the bath, right, guys? Now it's time to rinse the booty. You can see only her back end has been washed, so I just take a washcloth and I vigorously rub that area to get it dry. What did you do this weekend, Topanga? I just had a little spa day with the girls, you know, got my butt washed. The huge. Once the butt is as dry as it's gonna get, you can use a toothbrush to back comb. Great job! My next customer at the booty spa is Catalina. Baby shampoo. So one precaution, you never want to bathe a kitten who's really sick. Stress can have a major impact on illness, and if the kitten is already not doing well, you don't want to stress them out too bad. So if you have a kitten who's really sick already, I don't recommend dunking them in water. I recommend instead just using your baby wipes or using a gentle, wet washcloth to give them a sponge bath. Rinse the booty. Nice and clean. I definitely don't recommend doing this every day. I would try to limit it to once or twice a week since it can be pretty stressful for them. Hopefully they're not going to be having too many poop explosions on themselves. But if they are, then giving them a little oopsie poopsie bath is a very helpful thing to do. Now sometimes people will ask, can you use a hairdryer on these little guys? And the answer is yes, you can, but sparingly, only as needed, and from very far away on a low setting. If you do plan to use a hairdryer, do it from very far away, something like this. We gave your booty a blowout, girlfriend. Okay, Will's getting his booty soaked. You're purring, you kind of like that, huh? You are the most crustable of them all. He eats a ton and he poops a ton. Yeah, you're the tiniest, but you're the biggest pooper. You seem to have a lot of complaints. Hope you don't give me a 1-star rating on my butt spa. You did a great job, buddy. You did a good job. Okay, dude, check it out. You don't poop on yourself anymore, and I won't give you any more butt baths. Is that a deal? Now that your kittens are nice and dry, they can go back to their nice, cozy, warm blanket and get back to a good, comfortable temperature. Good job, baby. Good job.